everyone, and welcome to Voice of Care, Caring from the Heart. I'm Jolene, your host for today, and here on this podcast, we would like to keep healthcare simple and approachable. No complicated words, just simple language where everyone can take home and understand something out of it. So here, you could say that we are actually here to make sense of the things your body is trying to tell you. Okay? So today, we will be talking about a topic that everyone is very concerned of. Normally, it has been struck off, which is knee pain. So knee pain sounded like simple words, but it actually carries a lot of weightage. Why? Because it could affect your daily life as simple as getting up from the bed early in the morning. So it could be really challenging if you have knee pain. So lucky you, today we have a special guest, which is Dato Dr Vasan here with me, beside me. So he is an expert in orthopedic surgeon, and he is also specialized in arthroplasty, which is joint replacement surgery. So please welcome him. Thank you for having...
Hello, hi Jolene, how are you?
Thank you for coming here today.
Yes.
How are you?
I'm very good, yeah.
Could you share with me again what inspires you to become an orthopedic surgeon and more importantly, a joint replacement surgeon?
Okay, thanks Jolene. It's a long story, but I'll keep this long story as short as possible. Way back in 92 to 96 when I was in Sarawak, at that time we had shortage of orthopedic surgeons in Hospital Umum Sarawak. My boss then asked me if I would join orthopedics.
All right.
And I agreed because it seemed interesting and it seems like a man's world. You know, those days, a lot of instruments, gadgets and all that, it was only arthroplasty. So hence the birth of arthroplasty in my life. And I moved on to be an orthopedic surgeon. Graduated from University of Science Malaysia in 2001. And after that, I went on to Australia to do my subspecialty in arthroplasty under Ministry of Health.
Okay. So when did you start practicing in actually private sector?
Okay, it's a long story. I joined the service in 92, the government service in 92, and I came back to Ipoh in 97. I was, my last posting in the Ministry of Health was head of department of Taiping Hospital. And I left Taiping Hospital in 2008 to venture into the private sector. And I joined Pantai Hospital Ipoh in June 2008. That's 17 years ago.
That is really long.
Yes.
Yeah, thank you for the introduction actually.
Yes.
Yeah, that will be very grateful. Coming to one of the topic, which is someone where we commonly hear people say, you know, having knee pain is just basically due to old age. Is it true actually, this statement? Do you agree with this statement? And if other than that, is there any warning signs that you would like to share with us?
You're right about aging being one of the reasons for joint pain. I think we all have to undergo this process. It's an inevitable process. Yeah. All of us, at some point in our lives, we will have to go through that process. In today's world, it is no longer just aging. There are a lot of other factors that cause you to have joint pain. It's our lifestyle. It's the sporting activities that we do. And trauma, as in accidents and things like this. All these can contribute towards joint pain. All right, so that's one. What was the second question that you asked me?
What are the warning signs?
Okay, what are the warning signs? Okay, basically the warning signs are, first thing you will realize, you're a young lady, so you probably don't have joint pain.
I do indeed.
Okay, good. Then maybe you should come and see me. But as you grow older, you will realize, especially those of them who are in the fifth decade, or the five series, we call them, the 5 series, 6 series, 7 series. Normally when you reach this series, you start telling yourself, your life changes. Meaning, a very simple analogy is, you want to go to the supermarket. You will find a place where you want to park closest to the door. That is a change of your lifestyle. For a younger person, you say, it doesn't matter, I can park anywhere, but I can walk. But as you grow old, I mean, as these joint pains come and all this follows through, you realize that your lifestyle starts to change. You can't play contact sports. You want to do sports that are non-contact. Right? Yeah. So these are warning signs. And when you get up, after sitting for a while, you have joint pain, you need to stretch, prolonged driving, you need to stop, you need to get out, you need to exercise. I think these are some of the warning signs that tells you, hey, listen, I think it is time I go and check myself. I need to go and see an arthroplasty surgeon or an orthopedic surgeon.
How about like in symptoms wise, do they get like, other than pain, is there anything else?
All right, besides pain, whether there's anything else. Okay, number one, pain is the first telltale sign. First telltale sign of joint pain is pain. Okay. Number two is deformity. They start feeling that their knees is bent. I mean, I'm talking about the knee, right? Because most of the joints, I'm a lower limb surgeon, so most of the joint pain is around the knee, 80% around the knee, 15% around the hip, and 5% around the ankle. So that's how patients present to us. So you see deformities. Third, with deformities come reduced range of motions. So, for instance, if you in our practice, assuming if I see a Muslim, the first thing he will tell me is he's not able to pray.
Yeah, that's true.
He's not able to pray like he would normally sit on the mat and bend his knees backwards. He's not able to do that. The Muslim word is sujud. They are not able to do that. So he starts sitting on a chair and praying. So that's something that is debilitating for a Muslim man. But as for the older Chinese, Malay or Indian people, is squatting. As you understand, most of our culture is squatting. When they go to the toilet, they use squatting toilet. When they go anywhere, they like to squat and do their work. So they will not be able to squat, right? They won't be able to squat because they say that's something that they can't do anymore. And the next one is, of course, changes in activities of daily living. Now, that's a very important thing because it's about our lifestyle. Activities of daily living involves our lifestyle. It involves about what we do, what we are comfortable with. Now, I'm not able to do this, I'm not able to do that. My whole lifestyle changes. These are some of the symptoms that they come and tell you and the complaints that patients tell you.
Yeah. And also,
I hope that answered your...
Yeah, indeed, yes.
Okay.
It is true that when there is a change in your lifestyle, then they should come and visit a doctor to figure out what's wrong with them.
I guess so. They should come immediately. Yeah,
that's right. But why they still hesitate? They take it as a norm, I guess.
Okay, good. Very good question. I'll tell you something, Jolene. I only realized this when I went to Australia for my subspecialty. It's a totally different game changer, okay? In Asia, how we practice medicine is, people would come to see you at the end of the disease, okay? Like for instance, if Mr. A has got knee pain, he would only come and see you when he is wheelchair bound.
That's true.
He won't come and see you when he's got pain. He won't come and see you when he's got deformity. He won't come and see you when he's not able to squat. No, because he's still able to do other things. He'll only come and see you when he's not able to walk. Now, when they come at that time, they come at the end of the disease. At the end of the disease. And they would expect you to reverse that cycle to come to the front line. Whereas in the Caucasian world, it's the primary health which is very important. So this is something that Asia, it's catching up now. We talk about primary health because this is something that has to be inculcated in our children from a very young age about when they have problems, who should they see, how they should complain, they should see. So, like when I was in Australia, people would just walk in and they say, "Hi, Doc, how are you?" And they say, "Yeah, I'm good." And they'll say, "Doc, I think my knee needs to be replaced." That's how they talk to you. Yeah. It's not the other way. Here, I would have to explain. I said, "Auntie, uncle, your knee is bad and it needs to be replaced."
Yeah.
Replace? Oh, no. That's the last thing they want to hear. Yes. You see, but they don't realize that the moment if you do a knee replacement, the joint pain is gone. And that's what you want. You want that joint pain to go. You want your life to be stress-free. Yeah. So this is something I think comes back down to primary education. So I think this is something that we have to inculcate in our children and maybe in your grandchildren.
Okay, but let's say if you encounter a patient who comes to your clinic and you suggested them for surgery, how would you advise them? Because I suppose many of them are on the elderly age, so they would have fear of doing a surgery.
Ah. Good question, Jolene. Good question. Because this is something I think everybody goes through. Look, I'll tell you something. Since we work, you're a doctor, so I'm sure you understand. We work in a medical profession. For us, we are not afraid of seeing blood or seeing a needle. But you'll be surprised. You'll be surprised. Many people out there are actually afraid of a drop of blood, even looking at a syringe. Many people are afraid. When they are afraid, what happens is that puts the fear in them. So it's for me, when I talk to them about how to overcome this fear. All right, so I've got many parameters, okay? Number one, I have a lot of material that I put out in my clinic. So patients actually look at it and understand what joint replacement is all about. They go through the whole thing, they can actually understand. And I actually encourage them to ask questions. So they actually write down and ask me questions about what you want to know, how, blah, 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 blah. So a long story short, in my clinic, what I would do is the moment you come in, I would explain to you that if you need a joint replacement, what needs to be done. I would get a physician to look at you because most of them who come to me are in the 5th, 6th or 7th decade, okay? Meaning 50, 60 or 70 years of age. So at that point of age, they have a lot of medical problems. They may. The lucky ones may not. So those who have, I get a physician to have a look, give me a clean bill of health to tell me that, look, so-and-so is ready for surgery. Then I take over and explain about surgery. I tell them about how the surgical process goes ahead. Now, generally, it's a 4-day process. Day 1 is you get admitted and seen by an anesthetist. All right. Day 2 is surgery. Day 3, the drains come off. And day 4, you go home. So by day 3, you are already walking. Sometimes I walk them as early as day 2. All right. Day 2 meaning the days in hospital. But as of post-operative day, it is always post-operative day 1, I start walking them. All right. So, and the earlier you walk them is actually better because that gives them confidence that they are able to walk.
And let's say after they discharge from the hospital, how is the recovery process like? How long will it take for someone to start walking back?
Okay, that's the $1 million question they all ask me before surgery is, will I be able to walk? Of course you'll be able to walk. The idea of joint replacement is for you to walk. Joint replacement started way back in the 1950s by Sir John Chandley in the United Kingdom. This was all done way back then. So it's about 70 years of joint replacement, and we have moved leaps and bounds forward many years ahead of time now. And the question that they always ask, can I walk? Yes, you can walk. Definitely you can walk. All right. Number 2, can I get back to playing sports? Would be the next thing. Can I get back? Yes, you can get back to playing sports once your wound heals, and if you are well and you have no issues, you can get back to playing non-contact sports. I do not encourage patients with joint replacement to go for contact sports, no, but non-contact sports, yes. Meaning like you can play badminton, you can play tennis, you can swim, you can do horse riding, you can do all this, you can do a little bit of hiking, depends on how aggressive you are, and those kind of things.
In your opinion, which sports would you actually recommend? Which is better for?
Oh, I love swimming.
Swimming will be better.
I love swimming, so I would always tell all my patients that they should go and jump into the pool and start to swim.
Yeah. And it doesn't put any weight on your knees also in that way, right?
Yeah, well, that is in the beginning. But the idea of joint replacement is you want them to apply force on your knee. You want them to do that. You want them to do that. But the idea of being in the pool is weightlessness, so that you can actually develop your muscle strength. You see, when you come to see me, you actually have pain in your joints, and you may probably not been walking for a long time.
Yep. Yep.
So your muscle bulk has actually become smaller. So now you need to rebuild that muscle bulk.
Then when you're talking about muscle bulk, can I ask you further?
Sure.
So when it comes to physiotherapy, would you recommend a person to do like what's the frequency of the physiotherapy? There's a myth that people say if I do too much, I get tired, and then the next day they don't feel like doing, skip the sessions.
It seems like, Jolene, you should be an orthopedic surgeon. You're asking all the right questions. Okay, anyway, as far as physiotherapy is concerned, I normally start physiotherapy before surgery. 1 month before surgery or 2 weeks before surgery, I subject my patients to physiotherapy, starting with static quadricep exercises and range of motion, explaining to them what needs to be done after surgery. So before surgery, my patients are all already starting to do their exercises, so that the moment surgery is done, the very next hour they start their exercise, so that they have an easy post-op period. And once they are home, my advice to them is physiotherapy maybe for the first 2 weeks, twice a week or 3 times a week for the first 2 weeks. Once the stitches come out or once the dressing all comes out in 2 weeks, no more physiotherapy, you can just carry on doing your normal walking.
So let's say throughout your journey, have you seen any really inspiring or dramatic before and after experience of a patient? Who knows, some of them really, really
Actually, all my patients are very dramatic.
Really?
Yeah, Asian patients are very dramatic. But I'll tell you a story about a VIP. I won't mention his name, but he's no longer with us. But he is the person who actually inspired me to do joint replacement, and I did a hip replacement for him. Okay, and this man, the moment he woke up from surgery, I operated on him at 10 o'clock and I saw him at 2 o'clock. Yeah, it was about 4 hours after surgery. I was in his room and I was talking to him. The first thing he said, "Can you please close the door, young man, and can you help me to the toilet?"
Okay.
I said, "No, I just done surgery. It's tomorrow, nothing from today." He insisted that he wanted to go to the toilet. So I helped him up, and that was the fastest recovery I had seen. He got up, he went to the toilet, he eased himself, and then he told me that he's ready to get back to the bed. He went back to his bed, he slept on his bed, and he said now he is satisfied that he can walk. But of course, he is a VVIP.
That's really fast.
That's very fast.
Yeah.
That's because that's just VVIP. But these are some of the people that inspire you to do better.
To do better.
Because when you see people like this, they actually make your life, and then they say this is a challenge. But of course, whenever you do joint replacement, there are certain things that these are the things that you must be very careful. Many of them have a lot of medical illnesses, so you must make sure that all these medical illnesses are addressed. If it's necessary, you got to get a cardiologist or a physician in to make sure and proper assessment is done so that all these patients are ready for surgery. Because whatever it is, it's a major surgery, and there's a lot of stress on the heart, there's a lot of stress on the patient, there's a lot of stress on the relatives. Okay? So these are things that you must be ready to encounter. And most important, I think you need to explain the surgery to the patient and the relative, which is something that I do regularly at all times for all my patients before surgery.
Because most of the patients you handle are on the elderly age sense.
Well, they're all in the elderly, and not only elderly, now the trend has changed because most patients also have children who are doctors, children who are well educated, and of course social media. If they see the wrong thing, then they come and ask you all the wrong questions.
Yeah, that's true. That's what they get from the
so
internet.
This is something that you must learn to explain to them, that social media doesn't mean that everything is said on social media is true. All right? So that's where you have to come in, and this is a very serious business. You have to make sure everything is explained so that patients understand. And here in, of course, Pantai Hospital Ipoh, I think we have a very serious team. I'm a serious surgeon. I've got good anesthetists, and I've got good physiotherapists, and I've got a very good set of nursing team. So I think, and now we have robotics.
So say
Yeah.
here, from the way I understand from you, I suppose we have a comprehensive service in Pantai Hospital.
Yes, we have.
is it?
Yes,
Yeah?
yes, we do, Jolene. In fact, I think over the last 17 years, I've seen how this hospital has moved leaps and bounds, and it has grown. And it is good that we have a very senior group of people running the show.
Yep. Thank you. Thank you for sharing all this information with us. Do you have any last advice, take-home message for the audience to?
I don't have last message.
Sorry. One of the things.
It's okay. I understand what you're saying. Yeah. I'm just pulling your legs, Jolene. Yeah. I think the take-home message from this podcast must be, number one, if you have joint pains, please go and see an orthopedic surgeon, and especially those who do arthroplasty. Please see them, talk to them, get an advice, all right? Rather than seeing people who are not trained or people who are not from the medical fraternity, but claim to be able to deal with any kind of joint pain. That's number one. And number two, when your activities of daily living is impaired, meaning there are multiple stops to your activities of daily living, probably that is the time you should come and see us. And number three, I think in Pantai Hospital Ipoh, of course, I think we have a good set of surgeons, anesthetists, and backup services, as in nursing and physiotherapists. And I think that's where you should be.
I also agree with you.
Oh, thank you very much, Jolene.
All right. So thank you for spending time with us today.
Yes, thank you.
It was very insightful, I suppose, for myself and also the audience today.
So, Jolene, thank you very much for having me on your podcast.
I should say thank you.
Having said all this, Jolene, where can I look up all this podcast from? Where is it going to be broadcasted?
Well, actually, we have a lot of, we will display in a lot of places in our social media.
Oh.
You can follow us on Facebook, Instagram, YouTube, LinkedIn, and also TikTok.
Okay.
Yeah? There's actually quite a lot. So all you need to do is just type Pantai Hospital Ipoh and you will find us.
Okay, good. Thanks.
Right? I hope you can follow us too.
Yes, of course. That's what I'm asking.